If you are having azoospermia, that is inability to produce sperm cells, the problem can be from three ways. It can either be from the testis, which is called primary hypogonadism, which means there's a problem affecting the testicular environment, preventing it from being able to produce sperm cells. This can include problems such as hydrocele, varicocele, cryptorchidism, epididymoitis, testicular atrophy, and the likes. It can also be from the brain, which is secondary hypogonadism, which means there's an issue with the brain's communication with the testicular environment, and this is often reflected in the hormonal levels. There can be issues with the prolactin, with the LH, and the FSH. It can also be a combination of both. I've seen cases of patients having both primary and secondary hypogonadism. They have high prolactin, they have low FSH and LH, and they are still having issues in their testicular environment, such as varicocele and hydrocele. So it is unwise to commence treatment without properly going for all of these tests to have a proper and comprehensive knowledge on the underlying condition. It's not a waste of money. It's not a waste of time. I told a patient today to go to the lab to do scrotal scan and hormone test, so we can know if the condition is primary hypogonadism, meaning if his issue is from the testis or from the brain. He said when he got to the lab, they told him to do the hormone test, that he should not do the scrotal scan because doing the scrotal scan is a waste, that he should do the hormone test first and treat hormonal issues. Then if the condition did not go, he should now go and do scrotal scan to see if there's an issue. This is just waste of time. How much is the scrotal scan test? It's very important that we check from all angles to know if there is issue here or if there is issue there. And if there is no issue there, that is not a waste of money. It is just a clarification. So it is very unwise to tell someone to commence treatment with just a side of the story. Why not have a full-blown, knowledge on what is going on and know where the problem is coming from? Because there are cases, in fact, just last week, a man was telling me that he also went to the lab to do scrotal scan, but they told him not to do the scrotal scan. So he did hormone tests only, and he has been on hormonal treatment for over a year, and the condition still remain. So when I told him to go for scrotal scan, it now indicates that he has varicocele and some other issues. So he now started the treatment for varicocele again. What he should have known since then, and he would have been doing the treatment altogether. So it's very unwise to do only a part of the diagnosis and leave the other parts, saying that if you do this one and you treat it and it did not go, then go for the other tests. Why not do all the tests at once so that you can have a full knowledge of what is going on and you can address the condition comprehensively? So this is my advice for you guys. If you're having azoospermia, go to the lab. Tell the lab attendant that I want to do scrotal scan and hormone assay tests. It's not a waste of money. It's just very important for proper understanding and clarification of where the problem is coming from. Thanks so much, The Criterion Cares.